Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 3. Care of clients under emergency situation. Toxicological emergencies. Toxicological emergencies involve an acute poisonings, overdoses, or intake of abuse or illegal substances, over-the-counter medications and prescription drugs. Emergency care involves rapid identification of the substances used where treatment is directed towards preventing or decreasing absorption and symptoms. Exposures occur through inhalation, ingestion, injection, or contact with skin and mucous membranes. Antidotes are available for a variety of substances. 1. Poisonings. A poison is any chemical that harms the body. Poisonings can be accidental, occupational, recreational, or intentional. Natural or manufactured toxins can be ingested, inhaled, injected, splashed in the eye, or absorbed through the skin. Severity of the poisoning depends on type, concentration, and route of exposure. Toxins can affect every tissue of the body, so symptoms can be seen in any body system. Interventions includes the following. Specific management of toxins involves decreasing absorption, enhancing elimination, and implementing toxin-specific interventions. Consult the local poison control center 24 hours a day for the most current treatment protocols for specific poisons. Options for decreasing absorption of poisons include activated charcoal, gastric lavage, administration of cathartics, dermal cleansing, eye irrigation. The most common and effective intervention for management of poisonings is administration of activated charcoal orally or via a gastric tube within 1 hour of poison ingestion. Many toxins adhere to charcoal and pass through the gastrointestinal (GI) tract rather than being absorbed into the circulation. Activated charcoal does not absorb ethanol, hydrocarbons, alkali, iron, boric acid, lithium, methanol, or cyanide. The administration of cathartics, whole bowel irrigation, hemodialysis, urine alkalinization, chelating agents, and antidotes increases the elimination of poisons. Cathartics, such as sorbitol, are given together with the first dose of activated charcoal to stimulate intestinal motility and increase elimination. Patient teaching for toxic emergencies on how the poisoning occurred. Arrange for an evaluation and follow up by a mental health professional for all patients who experience poisoning because of a suicide attempt or substance abuse. The Occupational Safety and Health Administration should evaluate all poisoning related to an occupational hazard. 1.A. Carbon monoxide poisoning. Carbon monoxide poisoning is an example of an inhaled poison and is the result of the inhalation of the products of incomplete hydrocarbon combustion. It may occur as an industrial or household accident, or as an attempted suicide. The affinity between carbon monoxide and hemoglobin is 200 to 300 times that between oxygen and hemoglobin. Carbon monoxide combines with hemoglobin to form carboxyhemoglobin. As a result, tissue inertia occurs. Assessment includes the following. Assess airway and breathing. Respiratory depression may be present. If the carbon monoxide poisoning is due to smoke inhalation, stridor, indicative of laryngeal edema due to thermal injury, may be present. Interventions includes the following. Provide 100% oxygen by tight-fitting mask. The elimination half-life of carboxyhemoglobin in serum for a person breathing room air is 5 hours 20 minutes. If the patient breathes 100% oxygen, the half-life is reduced to 80 minutes. 100% oxygen in a hyperbaric chamber will reduce the half-life to 23 minutes, and it serves as a treatment of choice. Intubate, if necessary, to protect the airway. 1.B. Drug intoxication. The following terms are defined for further understanding about drug intoxication. 1. Substance abuse. It includes the use of specific substances that are intended to alter mood or behavior. 2. Drug abuse. It is the use of drugs for other than legitimate medical purposes. There is a growing tendency among drug users to take a variety of drugs simultaneously. Polydrug abuse, including alcohol, sedatives, hypnotics, and marijuana, which may have additive effects. 3. Overdose. It refers to the toxic effects that occur when a drug is taken in a larger than normal dose. Table 1 shows the specific drug overdose presentations and interventions such as the following. 1. CNS stimulants such as amphetamines. Designer drugs such as methylphenidioxymethamphetamine or MDMA, ecstasy, ice, eve, cocaine, can be smoked in freebase or crack form, snorted, or injected. 2. Hallucinogens such as lysergic acid diethylamide or LSD, phencyclidine hydrochloride or PCP, mescaline, psilocybin mushrooms, Jimson weed seeds. 3. Opioids such as heroin, morphine, codeine. 4. Sedatives such as barbiturates, such as amabarbital and sacubitril. Benzodiazepines, such as diazepam and flurazepam. Other sedatives/hypnotics, such as chloral hydrate and glutathione. And 5. Alcohol intoxication. Generally occurs with blood levels greater than 100 mg per deciliter. Levels more than 400 mg per deciliter are due to rapid consumption of alcohol and represent a medical emergency. For clinical manifestations and interventions of such specific drug overdose, kindly refer to your copies. I will also drop the link on the description box below. 1.c. Alcohol withdrawal delirium. Alcohol withdrawal delirium, delirium tremens, or alcoholic hallucinosis, is an acute toxic state that follows a prolonged bout of steady drinking or sudden withdrawal from prolonged intake of alcohol. It may be precipitated by acute injury or infection. Symptoms can begin as early as 4 hours after a reduction of alcohol intake and usually peak at 24 to 48 hours, but may last up to 2 weeks. Assessment includes the following major symptoms such as tremors, seizures, hallucinations, usually tactile. Patient will present alert unless experiencing a seizure. If the patient is having a seizure, ensure the airway. Interventions includes the following. Protect the patient from injury. Take a breath analyzer reading. Using an alcoholic skin preparation. Draw blood for measurement of ethanol concentration. Toxicologic screen for other drugs of abuse and other tests as directed. Pharmacologic interventions. Diazepam, Valium, or chlordiazepam, Librium, for sedation. Sedate the patient with sufficient dosage of medication to produce adequate relaxation and to reduce agitation, prevent exhaustion, and promote sleep. Diazepam, Valium, or phenytoin, Dilantin, for seizure control. Thank you for listening. Have a good day and be safe. Agyamanag.